Hi guys, how are you doing? I hope you are well and welcome. Today we are going to learn about uterine fibroids, uh, and I think most of you have heard about this term fibroids because it has affected so many women. These fibroids are non-cancerous growths that occur in the uterus of women. Yes, women, when they are in their reproductive age, this is when most of them find out that they have fibroids. And so today I want us to learn about fibroids, about how you know you have them, how they present or the clinical features, and what to do when you find out that you have fibroids. So, uterine fibroids are non-cancerous growths that appear in the uterus, okay, and they appear during the reproductive age. So the uterus is also called the womb, and the womb is where a baby grows and develops during pregnancy, and this same place is where the fibroids grow. So the uterus has the size of a lemon. That is an average size of the uterus. It is the size of a lemon, and it stretches during pregnancy, and it is able to accommodate a baby. And so you find that these fibroids can grow as a single, or they can grow in a cluster. That means it can happen that you have one fibroid, or they can grow in a cluster. That means you might have many of them growing in the uterus. Okay, so study shows that 40 to 80% of women of childbearing age have fibroids. Okay, and many of them won't experience the symptoms. So for you to experience the symptoms of these fibroids, number one, you might find that they are large, or they grow, so many of them. But so many women have fibroids and they don't know because they are asymptomatic. That is why it is a range of between 40 to 80, because so many women have fibroids, but the fibroids don't show the symptoms, so they don't know that they have them. Okay, so what are the risk factors of getting fibroids, or what predisposes you to getting fibroids? Number one, we have obesity. So if you have your body weight is high, or you are overweight. If you are overweight, that means you are at a risk of getting fibroids. If there's a family history of fibroids, or maybe if your mom had fibroids, there is a risk that you might also grow fibroids. We have not having children. Those women who don't have those women who don't have children. You know, the childbearing age is between 18 to 45, and you find that if you delay getting pregnant, or if you don't have a baby at all, you might end up growing fibroids. And also we have those women who have early onset of menses. If your menses began early, then you are at a risk of getting fibroids. Okay, so as I told you, fibroids are non-cancerous. Okay, they are non-cancerous. However, those women who grow fibroids post-menopause, or when they are at menopause already, they need to be evaluated. Okay, if you grow fibroids during your menopause, then you really need to go to your gynecologist so that he can evaluate or he can examine your womb and to find out what might be the cause, because chances of growing fibroids when you are at menopause are very low, because also those hormones that are produced during the childbearing age, they are decreased, and during that time the chances of growing fibroids are very low. So if you grow fibroids past 45 years, make sure you follow up with your gynecologist so that he will follow up and find out if you might be having another problem. So the cause of fibroids is unknown. There is no known cause. If there is no known cause, then I think it is so hard to prevent getting fibroids. But those who are at a risk, I have told you, make sure you try so much so that you don't fall under the list of those people who are at risk of getting fibroids. Okay, so what are the symptoms, or how can you know that you have fibroids? As I told you, most women have fibroids, but they don't know. Why? Because they are asymptomatic or they don't show signs. But for those who have shown symptoms of having fibroids, number one, we have excessive or painful bleeding during menstruation. If during your menses or when you're having your periods, your monthly periods, you have excess pain, okay, there is this pain that is mild pain, mild abdominal pains or cramping, that is okay. But if you have excessive pain during your periods, okay, number two, if you bleed between your periods, let's say you have a cycle of 28 days. That means after every 28 days you receive your menses, but in between these 28 days you find out that you have some spotting. That is another sign. Number three, we have a feeling of fullness in your abdomen or bloating. Okay, if you have a feeling of bloating or you feel that your abdomen is always full, even after you have not, even before you eat. We have frequent urination. Frequent urination means you pee frequently, and this might be because the fibroid is pressing on your bladder. Okay, if you have pain during sex, you have lower back pains, you have chronic vaginal discharge, and you also have inability to completely empty your bladder, okay? And then we have periods that last more than a week, okay? These are the symptoms of uterine fibroids. Number one is said excessive or painful bleeding during your menstruation. We have bleeding between your periods. You have a feeling of fullness in your abdomen before even taking a meal. Okay, we have pain during sex. You have frequent urination. You have inability to completely empty your bladder. We also have back pains, lower back pains. We also have inability to completely empty your bladder. We also have periods that last more than 7 days. If you find yourself having such kind of symptoms, you just need to go and see the doctor so that he will evaluate more and find out maybe you might be having uterine fibroids. Okay, so I told you it can't be prevented. Okay, it can't be prevented because we also don't know the cause, but you can reduce the risk of getting fibroids by maintaining a healthy body weight. As I told you, those people who are obese, you have a risk of getting fibroids. So maintain a healthy body weight, okay? And also get regular pelvic exams, okay? Just you have to like visiting your gynecologist so that you get these pelvic exams so that you can rule out or you can know just in case you have fibroids. Okay, so how can the doctor know that you have fibroids? Number one, we have those symptoms. If you explain those symptoms to your doctor, he will suspect that you might be having fibroids, and then he will go ahead to do tests. Number one, he will do a pelvic ultrasound. It shows well when you have fibroids. We have an MRI. We have a CT scan. Okay, all these are imaging. So they show once you have fibroids, they can be seen. We also have a test called hysteroscopy. This is where the doctor uses a scope to look into your uterus through the vagina. There's a tool called a scope that the doctor will use to view through your vagina up to the cervix and then the womb. So this scope, it has a torch, so the doctor can be able to see on the screen whether you have fibroids or not. Okay, so what is the treatment of fibroids? Treatment depends on the size of the fibroids, the number of the fibroids, and also the location. Okay, the size, the number, and the location. So we also have pain medications. Also, we also have iron supplements for those women who bleed for more than 7 days. That means you lose a lot of blood and you might end up getting anemia. So we have surgery. Under surgery, there is a procedure called myomectomy where the gynecologist will just remove the fibroids, okay, without damaging your uterus. And we also have hysterectomy. This is where your gyna will just remove your uterus plus all those fibroids. Okay, so we have some procedure called uterine fibroid embolization. This is when a small catheter is placed to the uterine artery to block the blood flow from the uterine artery to the fibroids. And once there's no blood supply, then the fibroids will die. And also we have one called radiofrequency embolization. Okay, this is when the patient is put under an MRI. Okay, so that there is a clear view of the fibroids, and then an ultrasound is used to send rays, okay, and that targets the fibroid, and then these rays or waves, they damage the fibroids. Okay, yes. So as I told you, it's not obvious that your fibroids will be removed. If your fibroids are small, well, you can manage the symptoms. Okay. If the fibroids are big, and the symptoms are just disturbing you, you can get your fibroids removed. But if they are small, you can manage the symptoms and have frequent visits to the doctor, so that you can be on checkup. Okay. When you have fibroids, you can still get pregnant. Okay, but then depending on the size of the fibroids, if they are large, they can interfere with the lying position of your baby, and so your baby can lie in a breech position. Okay, or depending on the location, you might end up going for a CS during childbirth, so that it can be easier to remove the baby. Okay, yes. So for women, once you get to menopause, also the female hormones decrease, and once they decrease, your fibroids might also shrink. And also when you are pregnant, when you are pregnant, there's a rise in the hormones that are produced to maintain pregnancy, and those hormones, once there's a rise in the production of the hormones, also the fibroids grow. Okay, so when they grow, that is when now they interfere with the correct position of the baby. Okay, and so you should be ready for either a CS birth or a normal delivery, depending on the size of the fibroids that you have. Okay, yes. So at menopause, they will just shrink and go away. But if they are so disturbing, your doctor can get them removed. Okay, yes. So that is the simple discussion of the uterine fibroids. Yes, they are non-cancerous. They can be small. The size can differ. It can be 1 millimeter up to 20 centimeters. So that means fibroids can grow to as large as the size of a watermelon. Okay, so if you have fibroids, just follow up with your gynecologist. If you want to have a baby, he will advise you on what to do. He might get them removed so that you can get a baby, or if a baby can grow when you still have fibroids. Okay, yes. So that is it for this topic. And if you have a question, please, you can just ask me down there in the comment section. I will try as much as I can to answer you.